Okay, thank you all for being here and joining us on our September 9th, 2020 briefing. Hope you're all doing well. Let me just start by saying that it does not look like we'll be moving the purple out of the purple designation anytime soon. And it's not because the county is not doing well. We're actually doing well from our perspective. We've been stable for several weeks now, and we haven't seen large fluctuations of cases. But really the state's looking at two things now: the case rate and the positivity rate. We're doing very well on the positivity rate. We were at 7.8 on the case rate, and it was adjusted to put us at 7.7. But the state has put in a criteria there where if you are at 7.8 like San Francisco was, and they are doing massive testing, you get a credit for doing the testing, which dropped them all the way down into the 5s after you factored that in. And then if you're not at the state average of testing, you actually are penalized. So we are not being penalized. We're just in that state average there, where we don't get any additional credit for necessarily being there. And given our where we've been somewhat stable over the last several weeks, it looks like we're in that spot right there of that 7.6 or so case rate, 7.7, 7.8, somewhere in there. That's continuing, which will not allow us to move on to red like some of our other adjoining counties, namely Santa Clara and San Francisco. So we've been at a little disadvantage in that the state provided more resources for testing for those counties, and they're doing a lot more testing than us in San Francisco. I think there's somewhere in the 400 per every 100,000, probably over 3,000 a day being tested there. They also have Zuckerberg and UCSF and those big teaching hospitals where they're doing a lot of testing. Certainly Santa Clara has Stanford, which we benefit from also. But that is where we're at. We're not going to be moving in the near future. We'd have to be out of at 7 below for a period of time to make sure that we get out of there, and that will be difficult. And again, it's a 7-day lag time that they're looking at on the numbers that will determine if we make it out or not. On the numbers themselves, Tuesday we're at 8,807. That's a plus 55. All week long we've been rather low, at plus 21 on Sunday, plus 49 on Monday, and plus 55 today. Happy to report that the deaths have held at 136. We don't have any new deaths to report. We are working to increase the testing capacity at Verily with folks who are showing up. We want to try to get those up to 1,000 a day per site. Just give you an example. On Monday, we had San Mateo 797, so almost 800, and then we had 169 walk-ups, but we had 11% no-shows. Then we had tested 288 with 80 walk-ups. In San Bruno, we had 637 with 101 walk-ups with a 10% no-show. And then Thursday and Friday, we were in North Fair Oaks. And Friday in North Fair Oaks, we had 557 with 109 walk-ups and a 10% no-show. So we're always hovering around that 10% no-show. But anyone who has signs or symptoms certainly can go through their own providers, the primary physicians, and get tested. But either way, we recommend that you would get tested if you had signs or symptoms or had been exposed in a meaningful way. With the health facility numbers and homeless shelter updates, we have 16 guests in 14 rooms for the AHS in Redwood City around the county. And then we have in the AHS 85 guests, 76 rooms occupied, and then we have 99 guests around the county. A couple of county updates. Webpage for appealing health violation citations is now live at cmo.smcgov.org, hearing-requests. administrative citation. We also published the county budget, including that we've appropriated approximately $180 million for COVID response and recovery so far. And that'll be at the board meeting on 9/29. The Great Plates program, you can see, we bring that up. There it is. How many people served? This again is just an unbelievable benefit to so many. We had no idea how many would be benefiting from this, and we've had so many great, over 100 county employees involved in this. A lot of administrative work behind the scenes here. But I'm happy to report that it will be, the FEMA funding will be extended to October 9th. So we will continue it another month, which is great. And we would continue it on our own dime through the rest of the month if it ended. But we hope that it continues to go. It's always a couple of days right before it's supposed to end that we are updated. So that is the latest on that. The census update 2020, San Mateo County response rate is 77.4. The closest to us is Contra Costa, 76.1, only 1.3 difference. We are in the final 21 days, pending some court rulings here that are out there. We'd love to see, obviously, this continued. There is a restraining order in effect right now, but we'll see. We'll continue to monitor how this really impacts the census. I can tell you, what we're up against here. We had 2,000 enumerators assigned to San Mateo County. We now have 10. The rest have been pulled out of the county to go to other jurisdictions that are not performing as well. But it seems like we're being penalized for being a performer and really being a leader in the census in our organization and the way that we've put this together, and certainly embrace the CBOs and volunteers and everyone else to get those numbers up. So now we are at a disadvantage because the enumerators have been pulled. So it's something that we'll continue to monitor. We have CBOs that will be out there working actively over this weekend, Friday, Saturday, and Sunday, trying to make sure that everyone possible has had the opportunity to sign up. And we'll do a final push at the end of the month if we have to. If it comes down to the end of the month, we will do a final push. On to some of the questions. Has the orange layer of haze caused anything to change for the county operationally? I think we see a lot more lights on outside than we normally would at 11 o'clock, 12 o'clock in the afternoon. But really, we haven't had any more calls for service. It's just an eerie feeling, and I think a lot of people are taken aback by what these wildfires can do. And given all that we've been through with COVID and wildfires, certainly many people are wondering what is next. But we are prepared for whatever comes next. So I wanted to make sure that you all know that. Is it too early to attribute the uptick in hospitalizations to holiday weekend activity? We've got 40 people with COVID in the hospital right now. I think we had 36 last time we spoke, and that was a low. It's the weekend just ended. I would think it would be too early to tell, but Sarija, do you have anything to add?
Yeah, agreed. Usually even symptoms showing up might take up to a couple weeks. And then once an individual develops symptoms, we would expect a few days, if a condition were to worsen, to require hospitalization. As Mike was pointing out on the numbers, on the hospitalization dashboard, you can see the trend is generally downward. I mean, here up one day, down another day. We have a line that shows the 3-day average, generally downward, and we continue to have robust hospital capacity.
Okay, thank you, Sarija. Next question, are there health measures taken in Santa Clara or Santa Cruz County that are different from what we are doing that have assisted them in being moved to a less restrictive tier? I think I addressed that really, I mean, if you look where they were, they're, for San Francisco, I think that they were at the unadjusted rate of 7.7 or 7.8, just like us. And I think Santa Clara was right there too. what pulled them into the other category was really the amount of testing they're doing. And certainly we have the mechanisms in place. We are flexible. Health has done a great job of building in flexibility to our testing, not only through Verily, but on demand, or as we see hotspots, we can go in and test. But the state has certainly provided Santa Clara and San Francisco with more testing than they've given us. And certainly San Francisco has used that to their advantage, as well as Santa Clara, to move out of the purple and into the red. We'd hope to get there too, and we welcome more resources from the state to achieve that.
Great. Looks like we have a hand raised. Sarah Wright. If you'd like to unmute yourself.
Hi, thank you. Can you talk about how the CZU fire has affected the ability to conduct census counting on the South Coast?
Yeah, it certainly has been interrupted, and it's a very, very difficult place to count to begin with. This has only added to the disruption, along with the COVID crisis out there. We are taking every opportunity to try to engage with the public as they come in for treatment for COVID or for a vaccine for a test for COVID. Any of those type of things, we're taking the opportunity to talk to them about the census, but it's just not enough, and it's certainly we feel it does have an impact on our ability to count out there. There's a lot of people that were displaced and are really more concerned about the things, the residences they've lost, the outstructures that they've lost, their livestock and things like that right now. It's just a very, very difficult time given COVID and wildfires to conduct a census.
And the next, looks like Henrietta Burrows has their hand raised.
Yes, thanks so much. You mentioned that the county had 2,000 enumerators and now it's left with 10. Who made the decision to pull out the enumerators? Where have most of them been sent now? And does the county have any recourse?
Yeah, well, I mean, it's really a federal decision. They've been sent all over. I mean, some to Palo Alto, some to San Francisco, some out of state. And, certainly Congresswoman Spear and Mark Berman and Kevin Mullen and certainly Jerry Hill, all our representatives have tried their best on this. But what's so disconcerting about this is that once they leave, it's very difficult to get them back, number one, but we've lost so much time. They were specifically trained in this county, and the areas were broken up in the undercounted census tracts. I mean, we're doing, admittedly, we're doing better than anyone else in the state, but still we should not be penalized for being organized and really putting our best foot forward and getting a lot of people counted up front before the enumerators came in with our campaigns and all that we've done through community affairs and all our cities. That's where we find ourselves right now. Again, we're at a disadvantage after all the work that we've put in, we'll continue to move forward. Obviously, we're employing different strategies. We're hiring CBOs. Again, they'll be out there this weekend. We want to make sure everyone is counted, and we may, then do a final push in the final week where we ask employees or volunteers or whoever, kind of like the one-day count, to go out and help us count those hard-to-count census tracts to make sure that we get as many people as we can.
Does the county have any say over where the 10 enumerators are left? Because there are still hard-to-count areas like East Palo Alto, which is still kind of lagging.
Yeah, and I don't think we do. We still have the homeless to count too, and that's what we were going to use enumerators for, to go to the homeless shelter, to go to our hotels that we have here and count those folks. And we will get that done by other means, but it does put us at a disadvantage doing that. But I got to tell you, Community Affairs has done a great job, and I continue to, I will expect them to continue to sprint through the finish line, which I know that they'll do.
And
Thank you.
there's another question related to the census. If there's any particular reason why San Mateo County has been so successful comparatively in the census?
Yeah, I really think it's because, we organized early. We had a great game plan. We've got great people working on the census. We've got the right people in the right places. We've got a very active CBO community here. We've got a lot of volunteers. The cities are engaged. All our partners are engaged. It's really the coordination and quite frankly, it's really the preparation before you get to the count that really, I think, plays such an incredible difference. And I think that we certainly led there and created some models that others have emulated. So I think it's all of that. And I just give all the credit to Community Affairs and Emma Gonzalez and her team and everyone that really has participated in this effort. So we're not done. And like I said, we'll sprint through the finish line. We'll, I fully expect us to be leading the state at the end of this the census it's the census count, and we'll put as many resources into it as we can. I also have another question here. Are the folks in place for how a vaccine would be distributed around the county when one is made available? And I'm sorry, it's not. It's are the talks in place? Are there talks in place? Sarita, do you want to answer that?
Sure. Yes, we're County Health is actively planning for how distribution of a COVID vaccine might take place. There are several moving pieces with the 2 vaccines and the logistics and the operations, as well as what populations would be prioritized. Might it be healthcare workers? Might it be residents and congregate facilities? So there are certain things that get directed from the federal and state government, and we are planning for the different scenarios and how we could maximize distribution and take up, also maximize trust in the vaccine as being safe and effective. We want everyone in the public to get their flu vaccine now as it becomes available. And then as we learn more and more about how a safe and effective COVID vaccine would be distributed, certainly keeping the public's trust in it will be important.
And it looks like there's a follow-up question. Has there been any explanation for why San Francisco and Santa Cruz have been given additional resources?
There really hasn't, but I suspect that they were lagging in the count, and that is why. And right now it's unfortunate, but we'll double down. We're not going to give up. We're gonna try to get all the help that we can locally, and that's how we've always kind of done it locally. To make sure that we get our folks in this county counted. And, we're just going to ask everybody to step up in the county and really help us. And for those out there who haven't, I mean, look, we got 25% in Atherton who haven't been counted. We're just going to ask them to take the time to take a few minutes to just be counted. In every city in between, we're going to ask the same thing. So, hopefully we'll have better news next week after the CBOs have been out there, and we'll have an updated count and show that we're making real progress.
And there's another question in the chat asking, can you tell us more about the health officer's emergency declaration related to the fires that was just released?
Yeah, we just talked about that, and really a lot of that is what FEMA had requested us to do. And Sarita, do you want to talk a little bit more about that?
Yeah, this is basically a measure to assure that any health protection for hazardous materials to be removed by local environmental health, that materials that could affect the environment or residents are able to be safely removed so people can return home as quickly as possible, and that we would qualify for any FEMA reimbursement for those activities, to steward the taxpayers' resources.
And Henrietta Burrows has their hand raised.
Great, Henrietta.
Yes, thank you. Sierra's second question reminded me of one that I had, and I wasn't quite sure that her question related to the census, because earlier you had said how the county is at a disadvantage in respect to other counties, and you had mentioned San Francisco and you had mentioned Santa Clara, that the county didn't have as many resources coming its way. What did you mean by that?
Yeah, so we had 2,000 enumerators here in the county, which would have, potentially pushed us way over 80% if we had all those new enumerators on the ground working. But they saw that we had already achieved a high level of response in this county. We're leading the state right now. So they took those resources and deployed them elsewhere.
Well, I meant in terms of COVID-19, when you were talking earlier about the county being at a disadvantage in terms of COVID-19. I'm sorry. Yeah, I'm sorry. Yeah, because San Francisco got both those resources. What I was talking about was the state has provided more resources in the way of testing to San Francisco and to Santa Clara. Remember, we had asked for additional resources and we were denied. Though San Francisco and Santa Clara got those resources. Why?
That's a good question. I wish I knew.
I mean, the rate is higher, isn't it? Is it?
No, I mean, I think that the rate is about the same. Sarija, I mean, you've got the latest numbers there.
I mean, is this a political decision? Tell me all decisions are political decisions.
Just confirming that the case rate overall in our region is very similar across our county lines, unadjusted. We are in a regional ecosystem. People live one place, work a different place.
Yeah, I don't think we ever really got a satisfactory answer as to why.
Is it final? I mean, is it something that can be appealed?
No, I mean, we tried. We had our assembly members and state center try. I mean, really the answer at the time was that, there was more of a need in those locations than in San Mateo County at the time. So that was what we were told.
Okay, thank you.
You got it. Okay, anything else? All right. Thank you all very much. Have a safe and healthy week. And certainly, if you go outside, please turn the lights on. It looks pretty dark out there. So take care. We'll see you next week.